Many people, they are taking inhalers and so many other medicines and cough syrups few months and few years, especially kids since 10-12 years, they repeatedly they are suffering with this, and we are giving a lot of antibiotics to treat lung disorders. First you have to warm lungs. So to warm lungs, so we have one point, L11 acupuncture point. Some people are feeling a dry cough, dry nose, and eye burning sensation, eye dryness, and bleeding nose. For them, I'm suggesting LU7 point. Just press 20 times. Namaskara. Good morning. Welcome to Nadiswara channel. Our ancestors, they strongly believed and they recommended few techniques. With that, you can cure without any either herbal or chemical medicines. So with that only the evolution of energy medicines came. In this energy medicine, what we discussed, you can change the body energies. So that energy will flow in different formats. In Indian philosophy, we call chakras. In Chinese, it is called meridians. The energy pathway will be there. For example, if you take lungs, so it starts here and it is flowing across the hand and it is ending in the big toe. Similarly, heart meridian, which starts here and flowing and ending in the this one. So that's why we are treating the meridians, not the organs. By treating meridians, you can heal the patient with single point. Let's take simple example. Today we will take the lung meridian. So lung meridian, the divergent meridian, it goes down, touches the large intestine, is the pair organ of the lungs, and it goes up and it creates the diamond shape in the chest, and it is touching the throat, and it is a lung one point, and it is going towards the thumb. So whenever there is a discomfort, I can say discomfort, or whenever there is a energy stuck, say energy stagnation in this lung meridian, so lung meridian, it starts, goes up and across the hand, and it also the divergent channel, it touches the throat and chest, it goes up down to the large intestine and coming. This is the direction of lung meridian. Many people, they are suffering with lung meridian with many illness. It may be a bronchitis, allergic asthma, dust allergy, running nose, nose black, and phlegm, cough, cold. All these symptoms which we are suffering, we are trying to treat the external projectory organ. Which is the external projectory organ? Normally, what are all the energy variations it happens in the lungs? It is projected in the nose. So you no need to use any nozzle spray or any balm which we are using to apply externally on the nose and this one. It is giving you a temporary relief. But the actual energy it is varying in the lung, variation is happening in the lungs, but it is showing in the nose in the form of nose block, running nose, sneezing, wheezing, and cold in many format. So to cure this, okay, so some are other way, there is a there is no smooth chi flow in the lung meridian. That is why if the lung in the lung meridian, if the chi flow is not smooth, it is going to end up with the energy deficient or excess in the lungs. Why the chi flow is not smooth in the lungs? Because in this lung meridian, what we call the energy channel, there is a stagnation of toxins. When there is a stagnation of toxins, the chi flow will obstruct. The obstruction of chi flow leads to the some symptoms. So this can be cured with a single point. And many people, they are taking inhalers and so many other medicines and cough syrups few months and few years, especially kids. Since 10 12 years, they repeatedly they are suffering with this, and we are giving a lot of antibiotics. So today we will discuss how we can come out of this without medicine and without meeting any doctors. That can be done without any external help, without any external medicine. So here the primary goal is you have to remove the stagnation, remove the toxins, and increase the chi flow. The third important thing is once you remove the toxins and increasing the chi flow, the patient will cure. But it should not reoccur. It should not reoccur means you should follow the some food instructions. By following this, you can cure your kid or yourself any lung or breathing disorders without medicine. So look at this image. If any lung disorders which is happening, it is affecting two ways. One, externally through ears, nose or mouth, the external heat or external cold pathogen is entering the body, and lung meridian or lung organ is the primary meridian which affects easily with the external environment variation. It may be a dust or cold or heat or any environmental variations, it will affect. The second important way is the lung meridian affects with the food which is given in the stomach. If the food which is having too cold and which is not able to digest properly, which is having high protein or which is having too much of kapha in nature, all those things will affect the stomach. So here let's take a few examples. In when we are in childhood, people used to tell, so don't take give milk more to the kid, so it will form the kapha. So why? The milk is very hard to digest. If the kid digestion is good, it's superb. No need to worry, you can give daily. But if the digestion is weak, then you should avoid giving a milk which is kapha in nature, cold in nature. And second important thing is fruits, and third is sweet. So we think that fruits are good for health and we are giving daily to the kids. And we also give one or other form chocolates, biscuits and bread. One or other form, we are every day we are feeding the sweets to the kid. So stomach, it's completely young organ. So what is there in the stomach? The stomach is filled with a complete gastric juice, its pH level is 2.5. So in Ayurveda, it is called Jataragni. It's a stomach fire. That stomach fire which is responsible for burning entire food. Within 2 or 3 hours, it will burn the food and it will convert into energy or in the form of juice. But when you keep on give cold food and sweet and kapha related food, the stomach become weak. When stomach become weak, so one you end there is an undigested food which remains in the duct. So there is a along with stomach one more organ. There is a spleen in Chinese medicine which is responsible for which is observing and circulating the food. So what food which is digested, the spleen will take upward towards the lungs, because lung is the factory of creating the prana shakti. It will take the air from the breath and food from the digestion, and it creates the energy, so that energy we are using for day to day work. So when we are giving lot of food which is cold and kapha related and sweet, so your stomach become weak. When stomach become weak, the undigested food it enters the lungs and it is going to end up with creating the phlegm. There's only two reasons which your lungs will be affected. The first reason is the external pathogen which is entering the ear through nose or mouth. It may be a cold or it may be a dust or anything else. And it is affecting the lungs and creating the coldness or dryness in the lungs. Depending upon that, either you get wet cough or cold cough or bronchitis or running nose. Or the another reason is, so your weak digestion which is creating the phlegm and it accumulates in the lungs and which creates the problem. So here is two motto. The one, you increase the lung immunity to the external pathogens. Even if you swim in the cold water, if you drive in the cold weather, it should not affect. You should warm the lungs. The second important thing is you should strengthen the digestion so that whatever food you give, it should digest. Initially, few days or few weeks, we are restricting the food until it becomes strong. Once your digestion is strong, lungs is warm, you can give any food. It will digest and it won't affect you. So now we are treating a lot of drugs, antibiotics that works for only few weeks. After a month or after 2 months, again the repetition happens. Nose block, cold, and phlegm accumulation and allergic bronchitis. When phlegm accumulates above the threshold, automatically what happens? Body will create the temperature to eliminate the toxins, to eliminate the phlegm. Because normal 37 degrees not enough, 98.4 Fahrenheit is not enough to remove the toxin. So automatically fever arises. So fever, it reaches 99, 1, 101, 102, 103. We should respect the fever. Fever is not enemy. Fever is not disease. Fever is our strength. Fever is our energy to clear the toxin. But certain temperature our body is unable to tolerate. That time we are giving some paracetamol. I'm not telling it's wrong. Don't think that I'm giving paracetamol, I'm curing the patient. No. Actually, by giving paracetamol, you're cooling the body and you are delaying the cure. So at the same time, sometimes if more than 1 or 2, 1 or 3, it is not tolerable, means I'm not objecting you to give the paracetamol. You can give the paracetamol, but that is not curing you. It is just you are relieving from the temperature. But if you want to cure, you should strengthen the lung, yang energy, chi energy, and second, you should strengthen the digestion system. By doing it, you can cure your kid without any medicine, and that kid afterwards, after curing, kid can eat anything and it is able to digest. So we will discuss how lung disorders happens with two different ways, from the external pathogen and other one is weak digestion. Let's see the treatment perspective of it. The first, to treat lung disorders, first you have to warm lungs. By warming lungs, you can avoid external pathogen effect. Nowadays, we are feeling that if you take small cold water or ice cream or some sweet or some external wind, we are ending with the some or other lung problems. So to warm lungs, so we have one point, LA11 acupuncture point. There is a one point, just the if you take this vertex triangle, okay, this is a elbow. This is the point called LI11. You just Google it for the exact position, you get to know that. This is a LI11 point. It's a yang energy point. So by just press 20 times, by pressing 20 times on the both the ends, you can feel the warmness, the heat in the upper body within half an hour, sometimes within 5 minutes. This will warm your upper body. Also that heat, it enters the digestion also. It strengthens your large intestine and digestive tract. So with this one point, you can warm your lungs more effectively than any antibiotics. The only thing is, whom you are treating, you should monitor carefully. What are all the points we are giving you? For that, there is a validation. Further, there is a limit. There is a positive and negative. So we are telling everything. Whenever you press this LA point, the heat increases in the body. You should not repeat this point again. Minimum 3 to 4 days. Just observe the patient 3 to 5 days, how is his warmness is increasing in the upper body and how the phlegm is reducing and how the digestion is improving in the body. If that is going well, just wait. Wait even 5 days, 1 week, 2 weeks. The patient is keep on curing, that's good, superb. So with one point, you can cure it. Or else, after treating this point, after 3 or 4 days, if the body temperature is too high and patient is feeling some dry nose and feeling some heat in the burning in the eyes and heat in the bowel and all. So that time there is a counterpoint for this is LU7 point. The LU7 is just if you take this thumb here where you are wearing the watch, this is the LU7 point. This LU7 point, just press 20 times like this. That's it. How I am doing this? That's it. Again, it will increases the moisture in the lungs. Not only in the lungs, it increases the moisture in the skin also. If anybody of you are feeling skin itching and skin dryness and more of skin wrinkles and dry hairs, just use this point once or twice in the gap of 2 weeks. So you can see the moisture in the skin and your skin itching will completely vanishes. So here we are using this point for the counter the LI11. With LI11, you are increasing warmness. That patient is withstanding and curing all the lung disorders is fine. Don't use LU7. After LI11, if heat is too high, then you go with LU7. Or else, after pressing LI11, you are feeling 50% better, the phlegm is reducing and allergy is reducing, running nose is reducing, it's good. But still more, if you want to give one more dosage, after 4 or 5 days, once again you press LI11 20 times in the both the ends. That's it. So patient will cure. So if you too cold, this one. If there is a heat, for example, some people are feeling a dry cough, dry nose, and eye burning sensation, eye dryness, and a bleeding nose. For them, I'm suggesting LU7 point, just press 20 times. If anybody asks me, okay, will you treat allergy? First I will ask, are you getting lung energy to the dust or to the cold? After eating fruits, after taking sweets, after exposing to the cold environment, if you are getting allergy, I'll use this point. If you are getting allergy towards the dust means it's a dryness, it's a heat. So then I have to cool the lungs. I use this point. So carefully monitor the patient. Once giving the point, wait for 2-3 days, observe. Depending upon that, you take the decision. Okay. Following this method, it may take 1 week, 2 weeks, or 3 weeks. You can cure the patient long lasting so that symptoms won't repeat for few months or few years. After few years also, if some symptoms comes, you know the technique, okay, which works, I can say 99% accurately. Thank you very much.